station, 98.1 FM, AM 1220, KHTS. This is a show for, about, and by seniors, giving information to enhance one's quality of life. And our studio guest this morning is Dr. Marwha Kilani, who's a palliative care doctor. Good afternoon. It's good to have you with us.
Thank you so much. Thanks for having me.
Hi, Marwha. Hey. How are you?
Good.
How are things?
Oh, good.
Nope, that's not working.
Yeah,
either.
things are going pretty well today. I'm taking a
Hello?
much needed.
Okay.
Can you hear me? Yeah, is that better?
I can't hear her.
Oh. Can you hear me?
I can hear you fine, but I think there were some technical issues. Just so our listening audience knows this always happens. But we're trying to.
Okay, there we go. I couldn't hear anything.
There you go.
So how are you, Dr. Kilani?
I'm doing good. I'm doing really well. I'm taking a half day off here, just hanging out with my dogs and enjoying the beautiful summer day.
Well, thank goodness it isn't too hot yet. But it'll get there.
Not yet.
Yeah, you deserve the time off. It's been a difficult 2 to 3 years for all frontline physicians, and you especially in the arena that you face with the type of medicine that you practice. And, you know, it kind of brings forward maybe a discussion that we should have about advanced directives and making sure that our listeners here in Santa Clarita and wherever else they are understand what an advanced directive is and how important it is if you are ill to be able to utilize that on behalf of yourself and your family. Let's go in, if you don't mind, talking about this issue on your day off.
Fantastic.
It's just something that I think a lot of people hear about, but a lot of people don't act on it. I can give you statistically that 1 out of 3 citizens, adults, have a advanced directive. 1 out of 3. That means 2/3 do not. So let's talk about an advanced healthcare directive. That's the legal title of it, the AHCD. Most of us just call it advanced directive. But let's talk about what that is.
Absolutely. Where to begin? An advanced directive actually is a critical tool in your healthcare decision making. And one of the things that I always emphasize with all of our patients and families is that it's not restricted to people who are either elderly or have a serious illness. It's actually a document that anybody over the age of 18 should be completing in order to identify, first and foremost, who would you want to make medical decisions on your behalf if, for some reason, you lose the capacity to make decisions. And I've seen this utilized as young as a 19, 20-year-old trauma victim, and seen it utilized in an individual well over 100 years old. So as you can imagine, it runs the gamut. The document is a useful tool. It is a document that can be located anywhere on the internet. You can Google advanced directives. In fact, the state of California offers free advanced directive forms that can be completed, and all you need are 2 witnesses to complete this document. It can be notarized if you don't have 2 witnesses that are not relatives, but otherwise it is a completely free form to complete, and it is really a helpful resource for anyone in healthcare that is helping you give you the best care possible.
What?
Yeah, and I think we have to realize that that not having this document could allow others to make decisions for you. So we have to be very careful. We have to be very careful and make sure that we understand this issue. And people are afraid when they hear legal document, and you've alluded to it already. The state of California has fill-in-the-blank advanced directives and can guide you through it, and you just have to go online and try to find it. But you do not need to have an attorney be involved. And for myself, Robin and I have advanced directives designated who our decision maker will be. But we did it, and then we had an attorney look at it carefully and rubber stamp it and say this is okay. And so we elected to do it that way. But you don't have to have a legal person involved. It's wise sometimes, dependent on the number of children and the real estate and things like that. But there's a lot of background stuff that one must think about. But I think it's important that people realize they don't have to have just the witnesses and not the legal folk. So we talked about going online. We talked about going to California, but there are definitely drawbacks when you don't have an advanced directive. Let's talk about those, because you've seen that especially in the past 2 years. What kind of havoc and chaos it creates in a person's life and a family's life.
Oh, it most certainly does. I deal with this actually every day, and not just in the last 2 years because of the pandemic and all, but it's really an everyday occurrence. We see it frequently in the emergency room, where we have no idea to what extent are we supposed to be providing certain types of treatments, or who is making decisions on behalf of our patients. It is a very confusing process for the healthcare providers. And unless we have one of these documents to really clearly delineate who's making decisions and to what extent should we proceeding with the type of care and the quality of care that each individual really is allowed to have, we are really forced to almost throw the kitchen sink even at each individual patient. So the importance of this document can't be emphasized enough. One of the things that particularly that is striking is when an individual, and unfortunately it happens quite frequently in the elderly, an individual could come out of the woodwork and start making decisions on our patient's behalf. And, we go with who's been assigned, or who is, a lot of times the emergency room or the paramedics will take down a contact information, and suddenly that person becomes the contact individual for decision making if that patient can't make decisions for themselves. So it's a little tricky. So we really do hope that all of particularly our senior citizens, make the right decisions and develop an advanced directive with the people that know them the best and how to honor their healthcare choices.
Well, Dr. Kilani, you being a palliative care doctor, does that mean that you advise your patients, or is this something already set up before you get involved?
It can be either way. Oftentimes, our patients come in, and just like Jean said, less than 30% of individuals have an advanced directive. That means that actually less than 20% are coming into the hospital without an advance directive. So oftentimes we are able to provide that advanced care planning education. And the hospital system that I work in, Providence, has a huge commitment to advanced care planning. And we have educational materials, we have the forms, we have the manpower to provide the resources and help with filling these forms out. And so oftentimes it happens in the hospital, but ideally, these things need to happen on an outpatient basis, either at home, at your kitchen table with the people that you love, and deciding who are those individuals assigned that you would like to assign to make decisions for you, and what sort of decisions, what types of health care would you want if faced with serious illnesses or any life-threatening events. So the ideal state is on an outpatient basis, but we absolutely are committed to providing that education in the hospital as well.
Well, now, being a palliative care doctor, does that mean you're involved with your clients before they get into the hospital? What is your role as a palliative care doctor?
My role as the doctor is really my particular role is confined to the hospital setting, and I have a palliative care team that is comprised of myself, nurse practitioner, nurses, social worker, chaplains, and we work together as a team to help care for the patients within the confines of the hospital.
I see.
However, because I work for such a large health system, Providence, we have community resources as well. We have community teams dedicated to providing palliative care. We even have a palliative care clinic over at the Disney Cancer Center in Burbank. So we have a lot of resources dedicated to providing this quality level of care for our patients who have serious illness. So all of our affiliated groups, such as Facey Medical Group, for instance, also have resources embedded within their system to provide advanced care planning education and training and classes. There's online modules for this type of need, and really the health system has recognized it as being a very important factor in how we care for our patients.
I see.
So Barb, to answer your question as well, I'm a primary care geriatric internist, and I see patients prior to going to a hospital, and that interaction is where the idea should be brought forward about advanced directives. It should not be once a patient arrives at the doorstep ill and needs to be cared for, and once they aren't able to sometimes give their direction as to who they want to make decisions for them, or what decisions they should be. So there's a difference from Dr. Kilani, what she's doing. She's seeing them when in the hospitalized ill patient, whereas your primary care doctor should be the one who does the advance directive as an outpatient. And as we both alluded to, the number of individuals who have advance directive is very low, surprisingly low. And we have to some of the groups she's mentioned has said, we have to up this, and we all know Kaiser, and Kaiser emphatically says you need to have an advance directive.
Absolutely.
Which is great. So we as physicians want people to have signed paperwork telling us if they arrive at the doorstep with Dr. Kilani there, she'll know exactly what you as an individual, even though you might not be able to say it, but she'll know exactly what your wishes are. And, that's the important thing, Barb, that as physicians, we try to act on a person's wishes and what they want. And we don't always know the patients well enough to get that feeling, but when it's on paper, it certainly makes a difference for us to be able to serve them better.
Well,
I don't know if you want to add something, that Dr. Kilani. I think that's these are important points we're bringing up.
Well, I remember when you came over and were advising Russ, you advised him to go to the hospital because of the pneumonia, and that he would be better taken care of there than at home. And now, when we got him into the hospital, Dr. Kwan came in there and suggested that I take him home and have a nurse come there. And I told him no, I couldn't handle that because I would have to be there and not always have a nurse there to take care of him. And I was not able to, that he was better in the hospital. And that's when he asked me, or was it maybe you asked me if he had a healthcare directive. And yes, we have it written in our trust. And he was taken care of there.
Yeah.
Right, and these are the situations we're talking about for our listeners to know that you think you're far removed from it, but you never know what might happen tomorrow.
That's right.
And so you really have to be prepared in advance. And that's what it is. We are, as doctors, we practice preventive medicine. That's
Absolutely.
what we try to do. And some of that is related to having an advance directive and knowing legally what an individual wants.
Yeah.
Absolutely. Absolutely. This is part of the package of doing your preventive health care. So just like going for a physical exam, going for your routine colonoscopy, your female examinations, your mammograms, whatnot, having an advance directive is just equally as important as that.
Well, I'm glad I have one, and I'm glad that we had one.
There you go.
Because it was...
And it should be prominent. That's the thing, Barb,
Yes.
that we need to make sure that individuals know that if an ambulance is called, that the advance directive is available. Already copies of the advance directive are available for the ambulance people and also the hospital people that they might come in contact with. So this is all important information that we hope our listeners are taking notes on.
Well, that's interesting because the EMTs that picked up Russ asked to see the healthcare directive. Now, how would that relate to the EMTs that take you in?
Well, we've actually done a lot of in-services with our EMTs and fire department. They are very much first and foremost asking for advance directives and also the POLST form, which is the physician's order for life-sustaining treatment. Now, that's another level of advanced care planning, but they recognize the importance of this tool, and they want to also be able to honor our patients' wishes, and so they're instructed to ask for that immediately. So, it's an important aspect of your care, just as important as your medication list. Yep. Your medication list is also extremely important because oftentimes a patient could be taking a medication that could be causing some side effects or whatnot, resulting in the need for health care. So it's just as important.
Yeah, let's talk about that a little more when we come back from the break. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220 KHTS.
No doubt about it, LA is an awesome place to live. But even while living in the land of beaches and mountains, it's safe to say that we could all use a real vacation right about now. One where you don't have to stop for gas, cook your own meals, or strip your own sheets. Lucky for us, Princess Cruises has a port right here in LA. Now, for a limited time, LA residents can sail with Princess from just $89 per day to the beaches of Mexico, the tropics of Hawaii, or cruise along the California coast without getting stuck in traffic. That's right, just $89 per day. And while these great destinations aren't going anywhere, these deals won't be around forever. So visit princess.com, call 1-800-PRINCESS, or contact your travel advisor to book your cruise today. Set sail with LA's cruise line, Princess Cruises. Terms and restrictions apply. Promotional pricing ends November 30th, 2021. Ships are Bermudan and British registry. Before booking, consult the CDC website at www.cdc.gov.
Today for lunch, why not try The Sandwich Shop, located on Avenue Stamford, right off Rye Canyon. The Sandwich Shop offers dozens of hot or cold, affordable, premium deli sandwiches. Gourmet soups and salads are also available. Regulars indulge in the cheesy focaccia rolls, which is a customer favorite. Then top it off with owner Charlie Chung's chunky chocolate chip cookies. Breakfast and catering is also available. The Sandwich Shop, since 1983, located on Avenue Stamford, right off Rye Canyon. ValenciaSandwichShop.com to place your order.
If you're in need of physical therapy, check out Focus Physical Therapy. Owner and therapist Adam Laraway has the latest in cutting-edge technology, introducing the Newbie, the ultimate in neuromuscular re-education. The Newbie can help you heal up to 70% faster and was FDA cleared in September 2017. The Newbie uses pulse direct current, which mimics the same neurological signals the brain uses and allows the therapist to identify those signals with 100% accuracy. Newbie can even help improve your sleep while tackling issues with neck, knee, and shoulder pain, sciatica, and arthritis. It can accelerate your fitness progress, which means better results in less sessions. Get stronger quicker. Why not use the same technology that the Dodgers and the LA Clippers use? Focus PT, located on Peachland off Lyons in Newhall. Call 255-4205. Go online at focusphysicaltherapyscv.com.
It's time to experience a pain relief, wellness, and anti-aging treatment unlike any other. It's time to check out Mend Cryotherapy. Relieve chronic joint and muscle pain, diminish soreness and inflammation, alleviate stress-related symptoms, boost immune system performance, and improve sleep and recovery times. Mend Cryotherapy is open Monday through Saturday, 11 a.m. to 6 p.m. Go to Mend, M-E-N-D, cryotherapy.com on Newhall Ranch Road in the Gateway Shopping Center.
We salute our veterans who sacrifice for our freedom. Every week, we share an inspirational story of a local veteran on our Hometown Heroes page at hometownstation.com, thanks to our good friends at Eternal Valley.
I'm Richard Nunnally, General Manager of Eternal Valley Memorial Park and Mortuary. We believe taking care of each other is what community is all about. We're proud to bring you the stories of our hometown heroes.
Eternal Valley, life well celebrated.
Visit hometownstation.com, sponsored by Eternal Valley.
Your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220 KHTS. And we're speaking with Dr. Marwha Kilani, who's a palliative care doctor. And Jean, why don't you talk about what we were talking about during the break?
Certainly, yeah. One of the terms that we are using, sometimes people they get like fog brain when they hear these terms, and we don't want them. They have to kind of hear these terms outright and differentiate between them. So we talked about the Advanced Directive, and legally it's known as the Advanced Healthcare Directive, AHCD. But I call it the Advanced Directive. It's easier on the tongue and the lips trying to figure this out. But we mentioned a pulse, which is the physician order for life-sustaining treatment. And so these are two separate documents, but they're both very, very important documents. So Dr. Kilani, can you help our listening audience differentiate between those two documents?
Absolutely. So the Advanced Directive or the Advanced Care health form that we had been discussing is something that's reserved for all adult individuals. It delineates healthcare wishes. It also delineates who can make your decisions if you cannot make your own medical decisions. Who's your surrogate decision maker? The POLST form is different. The POLST form is the physician's order for life-sustaining treatment, and it is actually reserved for patients who are much more seriously ill. And that's the way that I like to explain it to your listeners today. Is it's made for patients who are almost, if you could consider it, frequent users of the healthcare system. So not just going to a doctor for just routine checkups, but for somebody who has advanced illnesses such as cancers, any type of heart disease, lung disease, kidney disease, or is on dialysis. These forms are very important to be developed with your individual. Usually it's done on the outpatient basis, but again, can be done in the hospital setting as well. And it helps to detail the different types of treatments that are available on a very higher level, life-sustaining capacity. So this form is a bright pink form. You can't mistake it. It is, I think they call it canary pink. I don't know where the canary part came out of it. But it is a bright pink form that most people, when they see that form, they know exactly what it is. It's a one-page form only on one side. And it's completed with a physician, nurse practitioner, or a physician assistant. The form has three important sections. The first part is whether or not if you lose your pulse, meaning you are dead, your heart has stopped, would you want to be resuscitated or not? That's part A. And if you choose to be resuscitated, then there's the next segment is part B. If you choose to be resuscitated, you will automatically get what we call full treatment, which means being placed on a ventilator, going to the ICU, using medications to support your blood pressure, all of those elements of treatment. If you decide from part A that you do not want to be resuscitated, but you still want elements of treatment, when you go to part B, there's other options besides full treatment. There's selective treatments, and there's also comfort care. Now, comfort care is really limited to patients who are towards the end of their life and are pursuing only comfort-focused treatment or what people would generally call hospice level of care. The selective treatments is oftentimes a choice that I see our patients make when they are a do not resuscitate or a DNR or allowing a natural death. Because selective treatment is still very aggressive in the treatments that they can receive on a hospital level, but it does not necessarily include being on a ventilator, for instance, or getting shocked if your heart stops with cardiac intervention. Now, part C is whether or not you would want to be on any artificial nutrition through a feeding tube. There is a trial basis. There's a yes, I want full artificial nutrition. So there's those three parts, part A, B, and C, are the three elements that a physician would be discussing with you, or a healthcare provider would be discussing with you. And then part D is the section where everyone signs their name to the document. The physician signs on behalf of the healthcare team, and the patient and or the patient representative can sign on behalf of the patient. So when we were discussing advanced care planning, again, an advanced directive is much more broad. It is much more inclusive of your values and preferences. It helps to delineate who can make that surrogate decision for you if you cannot. And a POLST form is really made for patients who are more seriously ill, who need more detailed discussion about life-sustaining treatment.
In other words, before somebody is admitted to the hospital.
Yeah. And it's also, again, a form that the EMTs or the paramedics, if they're being called on an emergency, will look towards, because if you have no airway, if you can't breathe, if your heart has stopped, they need to know how to honor you. They need to know, are we going to have to resuscitate you and put you on a machine, or have you chosen to allow a natural death? So these are really tough conversations, and it's reserved to be had with your provider. Again, ideally in the outpatient setting where you can have good discussion about what each of these elements mean.
And the big difference that I need to point out between the advanced directive and the POLST is that the advanced directive, you as an individual, you as the patient, are making the decision on the advanced directive. On the POLST, that could be different, and you use the term and or, because it is possible on the POLST that somebody else makes decisions. You know, you hope your surrogate, your loved one, is making that decision to sign the POLST, but it could be that you're not involved in that decision. It's an and or.
Correct.
The best way is to be prepared and preventative, as we've talked about, and have the paperwork done way prior to a situation where somebody else has to already start making decisions for you.
That's correct. And it's also important to know that the POLST form can be changed at any juncture, as well as the advanced directive. I personally had to change my advanced directive recently, and we decided to take one individual off as our surrogate decision maker and replace it with somebody else that we felt was more in line with our values and knew us better. So, and it's not a direct relative. I mean, I have one of my cousins who's going to be a surrogate decision maker of mine because we are very close. And, second to my husband, probably knows me the best. And the same thing with my husband. I'm his first decision maker, and the second person is actually his best friend who is in line to help make decisions. So it does not have to be a direct relative, but it has to be somebody who knows you the best and knows how you would want to live your life.
Right.
And that's what's important in the advanced directive. The POLST form is a whole nother level of decision making that really needs to be done with the guidance of a provider, a healthcare provider, physician, nurse practitioner, or physician assistant. So if you have a serious illness, you definitely should have a POLST developed to help us honor your choices for treatment.
And even if you don't have a serious illness, you should, even if you're younger, in your 30s, your 20s, you should be thinking about the need to have an advanced directive.
Absolutely.
Because it is necessary. You want someone, a surrogate decision maker, to be at your bedside making these decisions, and not someone who you might not know. Now, I want to bring to the attention of our listeners an important point. If you do not have an advance directive and you enter a hospital unconscious without that advance directive, the hospital or the doctor organization who's in charge of you could potentially make healthcare decisions for you. There are probably listeners who are thinking, no way that could possibly happen. But here in the state of California, we do, this is the law right now, where if you do not have an advance directive and you are unconscious, that potentially where other people are making healthcare decisions for you can occur. Why do I know that? Because Robin and I yesterday testified at the California Senate Judiciary Committee on behalf of a law that we helped to introduce, AB 2338, which adds next of kin to decision-making in the state of California. California, therefore, does not have this in law right now, and we are attempting to put this into law. It has passed. It was introduced on February the 16th of this year, has gone through the Assembly, is now going through the state Senate, and we're hoping that it passed yesterday. We're waiting for that word, and it will probably go to another committee, and we'll maybe add that to the laws in the state of California. So we know it's kind of fortuitous that we're speaking about it today, the day after we testify, but this is what the law says, and it lacks that we are trying to make an adjustment, and it's all coming from people here in Santa Clarita. So it's it's a great law, and we kind of should be all proud that we're all putting this together to help not only the seniors in our own community.
Well, yeah, but
the seniors all over.
Both of you are intimately involved with seniors. I mean, Robin works for the senior center. How more involved could she be than that? And you are a geriatric physician. I mean, you couldn't be any more involved.
Right, but involvement doesn't mean that we're going to make a law. And it just so happens, right, Barb, we happen to recognize that this law, the present law, was lacking. And the attorneys, as a matter of fact, who work for the state of California through this whole thing have been shocked that next of kin is not a part of California law. As a matter of fact, 46 of 51, including the District of Columbia, have next of kin in it. California does not. So all we're doing is adding what the other states have already, but shockingly 40 million people in the state are affected by this law. So we're kind of proud, but we're also happy to represent the Santa Clarita Valley in this whole process, and that we've been able to harness and utilize individuals who have helped us do this and get it into where it could become a law in the state. It's right up our alley right now. That's why I can, as a doctor, I can talk about this in a way with the public. So we in the range of KHTS radio can advise and educate our community. So it's been a little bit of a challenge for us, but it's all we're part of a learning curve, Barb. You know that, right? That we've always been that learning curve to put into the public's eye needs and education. And now we just happen to be putting a law out there.
And if Russ was with us, he'd be right beside you.
Oh, absolutely.
Doing the same thing.
He would be actually leading the way. I think from Russ we learned all these situations, and from our other people who brought it to our attention. So we're proud to do this.
Russ was was actually the originator of the Senior Center.
Senior Center.
Many years ago. Yeah,
absolutely.
he was. Well, ladies and
cool.
gentlemen, we need to take another break. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220 KHTS.
We salute our veterans who sacrifice for our freedom. Every week, we share an inspirational story of a local veteran on our Hometown Heroes page at hometownstation.com. Thanks to our good friends at Eternal Valley.
I'm Richard Nunnally, General Manager of Eternal Valley Memorial Park and Mortuary. We believe taking care of each other is what community is all about. We're proud to bring you the stories of our hometown heroes.
Eternal Valley, life well celebrated.
Visit hometownstation.com, sponsored by Eternal Valley.
In these challenging times with virus attacking, I built my immune system with IV therapy at Hestia Medical Spa. I'm KHTS owner Jerry Sreddy Goldman. My husband Carl and I believe Hestia Medical Spa IV therapy has been a powerful addition for strengthening our immune system. I've been using an IV combination of vitamins and minerals to help me fight off COVID and other viruses.
Boost your energy and immune system with IV therapy at Hestia Med Spa in Valencia. Details at hestiamedicalspa.com.
Helping lead the way to a greener future, all of Burtek's Santa Clarita Valley waste collection trucks run on clean-burning natural gas. Burtek takes pride in their community, and they've been serving the SCV for nearly 2 decades. Because at Burtek, we'll take care of it.
It's time to experience a pain relief, wellness, and anti-aging treatment unlike any other. It's time to check out Mend Cryotherapy. Relieve chronic joint and muscle pain, diminish soreness and inflammation, alleviate stress-related symptoms, boost immune system performance, and improve sleep and recovery times. Mend Cryotherapy is open Monday through Saturday, 11 a.m. to 6 p.m. Go to Mend, M-E-N-D, cryotherapy.com on Newhall Ranch Road in the Gateway Shopping Center.
Chiquita Canyon Landfill takes the waste from our homes and local businesses and puts it to good use. With cutting-edge clean energy technology, Chiquita Canyon powers 10,000 homes each year by harnessing the methane gas from the landfill. So, the next time you wheel your trash can to the curb, feel good that your waste is on its way to making green energy at Chiquita Canyon.
Chiquita Canyon Landfill, our partner in sustainable living.
If you're in need of physical therapy, check out Focus Physical Therapy. Owner and therapist Adam Laraway has the latest in cutting-edge technology, introducing the Newbie, the ultimate in neuromuscular re-education. The Newbie can help you heal up to 70% faster and was FDA cleared in September 2017. The Newbie uses pulse direct current, which mimics the same neurological signals the brain uses and allows the therapist to identify those signals with 100% accuracy. Newbie can even help improve your sleep while tackling issues with neck, knee, and shoulder pain, sciatica, and arthritis. It can accelerate your fitness progress, which means better results in less sessions. Get stronger quicker. Why not use the same technology that the Dodgers and the LA Clippers use? Focus PT, located on Peachland off Lyons in Newhall. Call 255-4205. Go online at focusphysicaltherapyscv.com.
It's like no other station I've ever listened to. It's great.
Your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220 KHTS. And we've had some very interesting conversations here with Dr. Marwha Kilani, who is a palliative care doctor. So let's continue, Jean and Marwha.
Well, we brought up some incredibly important points that all of us have faced on the front line, the scourge of this pandemic and the threats to especially the senior population. Marwha, I will tell you, for what you do, I mean, we honor you for all your efforts, what you have done for the community at your hospital. And it has not been easy. And to be tasked with this, you were on the front line. I'm sure there's a lot of our colleagues who have PTSD from some of the things they've had, the ordeals they've had, and the difficulties they've faced. But you had the department down there. You run everything, and I give you so much credit for everything you have done for the patients at Holy Cross Medical Center, Providence Holy Cross. And I tell you, it has not been easy, but, we give you a Purple Heart. We give you the Medal of Honor. We give you all of that because you have done a super job.
Oh, thank you so much. And again, you can't be an individual doing this type of work. It really does come from a team effort. And I can tell you that at Holy Cross, we have a fantastic palliative care team, as well as fantastic colleagues in emergency and critical care and oncology. We have so many amazing providers that it's been a pleasure to help care for our patients and truly provide the best quality care possible.
And that has not been an easy job during this pandemic era.
No, because there's been so much medical.
Yeah, it was. It's been a challenge, and it kind of ebbs and flows. So it's still an active issue, but we're getting through it.
Well, science and technology has made a huge difference. Our abilities to be out there in the media and put forward the information, and not all of the information has been correct. Why? Because we just didn't have the science and the knowledge. Mm-hmm. But and I'm not making excuses, but medicine has always been that way in the 40-something years that I've been practicing. Things change, things evolve, and medicine is no different. And we used to have Coca-Cola come from cocaine. We had cocaine in soda. I mean, this is how we've evolved. So, so with this pandemic, we've had to evolve too. But it has been a medical threat that we are getting through. And yeah, you're right. This is not over at all, Marwha. But we appreciate all your efforts and everything that you've done to help and assure that our patients in the community surrounding the Santa Clarita Valley are taken care of. So thank you for everything you've done and what your team has done at Providence Holy Cross Medical Center. It's been difficult, but it's been triumphant that definitely you have been able to take charge of this and bring some sanity back to our community. Thank you so much.
And it has been exhausting for you, I'm sure.
So enjoy your day.
Yeah.
Enjoy your half day off. We appreciate it.
Yeah, I'm just going to hang out here with my dogs.
I couldn't think of a better place. Like I hang out with my kitty cat.
Exactly.
Thank you. Dr. Marwha Kilani from Providence Holy Cross Medical Center, palliative care physician. Thank you for all your efforts and your background and education to keep us going.
Yes.
We appreciate it.
Yes.
Thank you. Thank you.
We are sponsored by Comfort Keepers in Home Care, Providence Holy Cross Medical Center, and Hestia Med Spa. Listen to us next week on the Senior Hour. Now go and enhance your quality of life.